From Sarah Scales, this is really about how we make sure that providers are given the freedoms. I think you talked, Tim, about the freedoms we wanted from on high to be able to get on with this. And I guess this question is, how do we make sure those freedoms are cascaded down to providers as well as place, so that people can figure out locally what they need to do rather than getting directives from on top. Sarah, do you want to, as an NHSE villain?
For my sins. So I absolutely recognise that we've had a very top-down set of directives. One of the things I'm pleased to see that the change to the ICS has actually changed the emphasis, where the centre is looking for assurance rather than actually dictating how things are done. And there's a freedom of movement, which I have to say, with my non-executive director hat on for Surrey Heartlands and conversations with other non-executive directors, we are further ahead in understanding the art of the possible in this new world era. I think the key for this is to stop thinking inside the silos that are, this is what a GP does, this is what the optometrist does, this is what the pharmacist does, this must happen in the acute sector. And one of the things I think we have the advantage of now with the integrated care system and the work that Claire did on the fuller stock take is to understand a patient's care pathway comes back down to a multidisciplinary team delivery, which is not always health related. Third sector, critical partners. Education, critical partners, the housing in which people live, critical partners. And so I think that that is the area where we have going to see some of the, I'm going to use the word shackles, broken. And I think that we are going to see a lot of innovation. That does not mean it's going to happen at the same pace in all sectors. But I do believe that we are going to see a great deal of change in the patient experience of their care pathway, and also their voice in the design of that care pathway. Now that will take a little bit of time. It will also take separate conversations, and not everything will be deliverable at once. But again, I think we have more freedom of movement at ICS level, but we also have to demonstrate that it is not just effective, but it's efficient. And that, I think, is going to be one of our biggest challenges, because we can't please all the people all the time, but we will really go a long way to improving things.
So I think when Surrey Heartlands was established, there's always been the vision of subsidiarity and place being the unit. In fact, not, Claire will say not even neighbourhoods, it's the person themselves, down to the lowest denominator. And we've got 4 places, and from my experience from some of our neighbouring ICSs, I think we are doing a great deal of work in our places, in our neighbourhoods. Yes, we haven't quite cracked the formal delegation and the governance and all of that as yet. That's to come. But we're delivering a huge amount just through partnership. And we can, in the future, do more perhaps, but form follows function. And what we are delivering now with our neighbourhoods, working with our partnerships. We've all got alliances and bringing our providers, our acute provider, our community, districts and boroughs, our third sector, voluntary sector coming together as partnerships. We've established alliances. So we've already got the mechanisms to deliver what we need to deliver, and real energy here.
Great, thanks, Shimona. Kate?
I think this is about relationships and trust. And belief in people. At the beginning of the pandemic, Surrey County Council did some great work, which is around turning around to lots and lots of commissioned services in the third sector and saying, actually, we know you can't deliver like we expected you to when we sign these contracts. Go and just do stuff, do whatever you need to do. And we were given the freedom. I had feedback from loads of my colleagues, with 1 or 2 exceptions, but most of the third sector were extremely positive about that switch at the beginning of the pandemic, that the voluntary sectors could go out and help people in the way that they could, given the massive change in our lives. But that needs to go forward, and it always, you talked about actually as close to the resident, and I think Shimona said to the resident, quite often, why is it we're not actually letting the resident make the choice about children's mental health. The I Thrive model that we've bought into, through Mindworks and from Tavistock and Portman, says that it's the young person themselves with their family that gets to say what's going to help them, what is it that they need to help themselves. So I think we need that trust all the way through the system, that belief that we don't hold things centrally. It shouldn't be, what enables me to give trust. It should be actually, the default should be all the power and all the decision making goes as close to the resident as possible, unless there's a really good reason why not. It's almost like we need to flip our model around from holding power centrally to devolving it all out.